I'm here right now with Dr. Frank Genco. And Frank, I'd like you to tell everybody about your career, about your training, stuff like that.
I trained in internal medicine in Yale affiliate in Connecticut. I practiced emergency medicine then for 14 years in New York, Pennsylvania, and Texas since '93. I then bought a place that we were doing a freestanding ER when that was popular. Back about 2005, we converted it to an urgent care rather than remaining as a freestanding ER. And I, after 14 years, just sold that. And I'm glad I did, because now their volume is down to 3 or 4.
Oh, wow. And how many do you normally have to have each day to actually break even?
Well, if I'm going to feed the staff, I gotta see about 15 people. But I need more if I want to turn any profit.
Gotcha. So you've actually done some research regarding the coronavirus, is that correct?
I've been keeping up with this pretty much from the beginning. I've been posting on my own personal Facebook since March 9th, when they canceled the NCAA tournament.
They made it personal at that point, huh?
Yeah, well, actually very personal, because my nephew was in the Sweet 16. And a couple games he'd be in the Final Four. And maybe national champions. As it is, we said he tied for first.
There we go.
But I have another niece who had to end her professional basketball career in Germany, and she had to fly back on the last day, or she wouldn't have been able to come back.
Wow.
So it has hit home. Not the COVID, but the reaction to the COVID.
Right. So let me ask you then, because you're a very smart person. I'm assuming you do your research. You know what you're looking at here. Do you agree with the assessment that many people have given about COVID as far as...
Not the authorities, not the experts, not the institutions. The thing I found from the very beginning is that they were reporting absurd death rates, 14%, and then they were coming down from there.
Right.
And this was at a time when they were saying that we didn't even have a test in the country, and how were they having reported cases then? And then they got to the point where there was one available test in Atlanta at the CDC. And most doctors weren't going to go through the trouble or had the means to get it there, and if you did, you weren't going to get the result back for a week. And so I knew at that point that reported cases were going to be 100 times. So even at the 14%, you knock that down, you're down to like 1.4%. Or 0.14%.
Yeah, exactly.
So the thing is, I knew then that we were under 0.3%. And I've stayed consistent with that as they've come down 8, 3, 2, 1, 0.8, and now they're finally coming down to the 0.3 range. Some of them are still resistant, even at this point, but it clearly is going to be less than 0.3. It's going to be less than 0.1.
I remember, you're talking about this stuff, and it was almost like if somebody got COVID-19, it was like a death sentence.
Yeah, especially if you were older or had comorbidities. I did a table, actually, it's on my Facebook site, one of the posts that I always post them daily, where I said, well, the news isn't reporting it, so what is mortality rates by decade? And so I looked it up. I had 2017 data, had nothing to do with COVID. What is your chance of dying in the next year for each thing? And it was exactly the same curve as you saw with the COVID. So it wasn't that COVID, that age is a risk factor for COVID. Age is a risk factor for dying. So if you have COVID, it doesn't add a lot. And the thing about it is, honestly, if you get COVID, it's not like your mortality rate is supposed to go down. It's not going to be protective. Nobody thought that. And, there's a lot of cold viruses. There's 200 different cold viruses. So there's a lot of deaths. It's actually the #1 cause of lost productivity among healthy workers. It's #2 is back pain and affiliated problems with back pain, but #1 is these 200 plus cold viruses, and one of them is coronavirus, and strains of that is COVID, and it was from SARS. This is SARS-2. Well, now in this SARS-2, we already had SARS-1, MERS before that, and a bunch of coronavirus before that. We're going to have a bunch more. In this one, there's actually a guy who did real science, and he said he does like little fingerprint on little changes in the RNA, and he said, you know what? We saw that there's already a strain, a substrain A, B, and C. So these people who think like, oh, we should be afraid and we should wait until this has run its course. Well, in Wuhan, it wasn't even A that was there. That was like a minor one. It had already mutated to B. And then C was not in China. It had mutated after it left China.
Okay.
So I don't know what we're on now, but it doesn't end after A, B, and C.
Right.
You know, like the cold virus is not going away, and there's 200 other friends.
Right.
So this has nothing to do with, you know, we can wait this out. You cannot outwait the cold virus. It goes around the world. I've been to the doctor, and they said, oh, it's going around. Well, it does go around. And this goes around, you know, there are birds, there are bats, there are other mammals, cats and dogs are carrying it. This is something you're going to be exposed to.
Right.
And you're going to get exposed to the next one too.
So I guess what I hear you saying, and correct me again if I'm wrong on this, but I hear you saying that this whole thing with the coronavirus, we have supposedly 65,000 deaths due to the coronavirus. Are you saying that that they may be misreported, or that I mean, how do you look at this when you see those numbers?
When I see the statistics, you have to have some basic knowledge to understand where are these numbers coming from and what do they mean. So when they start saying there's these thousands and millions and billions that, you know, and you realize most people can't handle these numbers. They're not used to dealing with these numbers.
Right.
So, but I know there's 7.8 million people in the world, and I know off the tip of my head, they're going to do a census, but it's about 330 million Americans.
Right.
So I'm able to actually, and I got a calculator, and now I know how to divide. So I'm able to look and see that when they were reporting world cases, that it was 0.03%. Well, for crying out loud, you knew it was more than 0.03%, and that was off by a factor of who knows, 10, 100, who knows.
Right.
So I said at that time on my post, we need serology. These nasal tests are not going to help us. And then the media, of course, was saying, oh, we need more testing. More nasal testing? It's worthless. And what is the sensitivity and specificity? It wasn't being reported anywhere. I was finding out that some of these tests with 36%, one they're currently using 70% sensitivity. The test by the World Health Organization was horrible. And Donald Trump gets criticized by the media mercilessly, but what did he do? They said, oh, he should have got testing sooner. He should have taken the World Health Organization test. The World Health Organization test at the time was terrible. And he recognized it because he had good advice. He doesn't get all great advice, but that was good advice. And he said, can we find a better test? He has simple questions.
Right.
So the thing is that we do not have 0.03%. That's about the number they're saying now. It's ridiculous.
Yeah.
The number of deaths is wildly off.
Yeah.
There's deaths that are being missed. There's deaths that are being added that are not COVID deaths, especially in New York, New Jersey, Connecticut.
Right.
Those are famous for overstating.
Right.
England also, the UK, overstating their deaths. The United States, there's a world, where they tally it by the world, by the country. We're number one.
Right.
Then there's like the 5 other countries that are lying, and then the United States is higher than 204 of the 209 remaining countries combined. And that is just not true.
Right.
And that the New York and Connecticut and New Jersey have more cases than the rest of the country.
Right.
That is just not true.
Yeah. So wait. So let me ask the question about that then, because as I was looking, I don't have the expertise that you do, and I will probably never develop it. So I'll be having to rely on people like you. But looking at, say, the Worldometer regarding coronavirus, that's what I looked at, and they would have the numbers down. No one that we, are they accurate? Who knows? But those are the numbers that were given to us as the public.
It's the number of reported cases.
Right.
So when you hear a statistic, they say like statistics lie. Well, they don't. They have to say what they're doing.
Right.
But you have to be able to interpret reported cases. What do reported cases mean? It means you're not getting all the cases.
Yeah. So I guess what I wanted to ask was that as I took a look at the numbers underneath from which we derived the statistics, 54% of the deaths took place in New York and New Jersey. So the first thing I said is this is not a Texas problem. Because you have, people say, well, there's 60,000 deaths. Well, 30-some thousand are in these 2 states. Right now you add Massachusetts, I think, with it as well, and you still have 55% of the reported deaths that they are reporting, however accurate.
And where they're reporting the deaths, they're making this stuff up.
Right.
Because they're saying if you die with COVID, not of COVID, that's counted. And the CDC, as a physician, they put an email to me and the physicians to say, we want you to count any suspicion of COVID death. Make sure you get it on the birth certificate. I got another on a death certificate, and I got another notice on how to fill out the death certificate. You need to say that it's ARDS, acute respiratory distress syndrome, due to pneumonia, due to COVID-19. And you know, they were even saying to the specification of, we don't want to call it SARS-2 because, you know, people have different variations. We want to make sure we count every one of these,
right?
Even if it's not because of COVID.
So you can tell me, because I've heard stories about this, but you're the first person I've been able to talk to that can verify that you actually received this correspondence from the CDC.
Yes.
Okay.
Yes, and from also there's another organization for vital statistics on how to fill out the form.
Okay. Now, were there any type of financial incentives attached to?
You know what? A lot of people think that there's you know, a lot of kickbacks to physicians, but physicians actually, by and large, are good, honest, hardworking people.
Right. Right.
But the other thing is, we're a group of rule followers. You know, so we tend to be. I'm kind of the exception.
Yeah.
In that I'm retired. What the Texas Medical Board sent me twice now was, if you're not following Governor Greg Abbott's executive orders, that you can be charged with unprofessional and dishonorable conduct. Well, that could put your license at risk.
Well, yeah.
And that would be that current. So before, you couldn't do a non-emergent procedure. You could not practice medicine in the field you were trained in, and then unless it was an emergency. And furthermore, currently they said you have to follow the current guidelines, meaning you have to maintain a social distance and a mask on you, an N95 mask and a mask on the patient. How are you supposed to examine their mouth or anything? And even if you take the mask off, you can't even get within 6 feet of them. So that's from the Texas Medical Board. So what happens is, you know, when you want to scare a doctor, tell him his license is at risk, right?
Well, absolutely.
His career is at risk.
Yeah.
So it didn't matter that I'm in Colleyville, and they said, well, you could open up what you're doing, but, you know, make sure that if you're a beautician or a doctor, that you're following whatever your specialty society is allowing also.
Right.
And so my specialty, like the legislative part of Texas is not allowing doctors to practice to their ability.
So it's the thing that
But to get back to your question, the doctors aren't getting a kickback. No. But they are rule followers. They do want to follow authority. They do want to be good citizens, and they're a little skittish.
Yeah.
Honestly, you know, they want to err on the side of being overly cautious.